Hi, my name is Melanie and I am your IVF nurse. Today we're going to be talking about the female reproductive system and in particular the menstrual cycle. So every woman has their own cycle length. Usually according to textbook it should be about 28 days. However, this is not always the case. Some women will have shorter cycles, maybe 26 days in length, and some women can have cycles where they're anovulatory, so they do not ovulate and may need to have periods induced every once in a while by their physician or a medication protocol. Now, there are several handouts that are available at your fertility clinic if you're interested in learning a little bit more of this. I'm just going to show you a quick glimpse of a resourceful flip chart that I have received. And this is something that I refer to regularly to help patients understand what is going on with their cycle. So if you look at this here, this is just the menstrual cycle. And if we're looking at this here would be considered baseline. So say when you get your period, day 1, day 2, or day 3. And basically what happens is the LH and the FSH are relatively flat. Your estrogen and progesterone are relatively flat as well. When we're looking at this here, the primary follicle is what a lot of us will refer to as an antral follicle. Now, as you progress through the cycle, so say this is day 1 of your full flow, as you progress, what ends up happening is your LH is relatively flat. Your FSH will somewhat peak on about day 3 or day 4 of the cycle. Your estrogen is relatively flat until a follicle actually produces. So as a follicle produces with an egg in it, we start to see a slight increase. Progesterone should remain relatively flat. Now, as we are going through the cycle, as each day progresses, what happens is as you near ovulation, so about day 10, 11, 12, 13, 14, if it's textbook classic, what will end up happening is your estrogen will peak at a certain level, and usually this is about 500 plus for mature follicle that you have, so hopefully there's a mature egg in there. The LH will begin to peak as well, or surge as a lot of us will call it, and over the 24-hour period what will end up happening is we'll see that it remains relatively flat, and then it starts to climb, and then it peaks, and then it starts to decrease, and then it flattens out again after ovulation. So same thing with the estrogen. As you progress through the cycle, the estrogen increases as your egg develops and matures, and then once it's matured, it signals in, the LH gives or fires off the egg or oocyte to be released from the follicle, and then what happens is the estrogen will drop and the LH will drop as well. Now, once the estrogen drops and the LH drops, we'll see an increase in the progesterone, and this is produced from what we call a corpus luteum. So when we're looking at the cycles, when you have your antral follicles on the start of your period, and then you have a secondary follicle, mature follicle as you progress near ovulation, and then when you're actually ovulating, what ends up happening is that the egg is released from the follicle. The follicle, the remaining bits of it, then turn into what's called a corpus luteum. And then this produces progesterone. So then we see this increase in progesterone. And then if you have not conceived, what ends up happening is that the progesterone will decrease. Everything, estrogen starts to decrease. Everything goes pretty flat. And then you will have your menses again. Okay, so when we're looking at the lining of the uterus, this is what we see. So when you're having your period, everything thins out, and then as you progress through the cycle, due to the estrogen that increases, what will happen is we'll see that the lining thickens up. Those of you doing an embryo transfer want this ideally, or even insemination, ideally to be above 0.7. And then if you're successful, then it just continues to remain thick. But if you are not successful in pregnancy, it will then shed, and that's when you get your period. So like I said, cycles can vary from woman to woman. This is just a quick little glimpse of the menstrual cycle. That was just a quick little glimpse of the women's menstrual cycle, and as I said, this can vary from woman to woman. So that concludes my little talk for today. If you have any questions or if you have anything you'd like for me to discuss, you can email me at yourivfnurse@gmail.com. Thanks again for watching.